Welcome to Lit Politics. I'm State Senator Alessandra Yuh-Line, representing the 34th District, covering parts of the Bronx and Westchester counties.
And I'm Assemblymember Yuh-Line, representing the 65th District in Manhattan, covering all of Lower Manhattan. Today, we are going to be having a dialogue from both of our houses, the Senate and the Assembly.
That's right, to shine a light and to have an important dialogue
about the process that we know as government.
And most importantly, how it affects you.
Hello, everyone. Welcome to Lit Politics. We actually had an entire show schedule planned out for our first season, and we were really excited about it. Our whole goal, obviously, is to make sure that government is what it should be, accessible and transparent.
Yeah, and you know, we were going to talk about the three branches of government, how our budget is made, what advocacy looks like, how a campaign is formed, and how everyday people can get involved.
But because so many people kept on asking us so many questions about what is currently happening in our state, we decided that we should break it down for folks to better understand and to also explain what is actually happening, how all the pieces fit together, and what went wrong.
What went terribly, terribly wrong.
So first, we have seen and heard, and we're a part of asking for the repeal of the governor's expanded emergency powers.
Where did they come from?
On March 2nd, the Senate and the Assembly actually passed a bill that permitted the governor to issue by executive order any directive necessary to respond to a state disaster emergency.
Right, and so this sounds like something that might be fine or okay on its face, but these expanded powers are powers that no governor has ever had, even in national emergencies as big as 9/11.
I have to say, I didn't vote for this bill. I didn't vote for that bill. Both of our healthcare chairs and a handful of other members didn't vote for that bill. And citing, they basically cited that Department of Health actually already had certain powers that were needed, and so did the executive. And so they shouldn't be expanded for the governor. We did do a video.
We did do a video
together
that night. That's right. And there's also a video of you on the floor explaining your vote that day. That's very powerful. So we wanted to make sure that everybody could see those things.
Yeah.
The governor stapled $40 million towards services and expenses related to the COVID-19 outbreak to some very concerning expansions to his own authority and power. This was done in the span of just a few hours, with no eyes on the language of the bill until just before the vote. Right now, my constituents are afraid. Afraid of the racism that is permeating throughout our country. Afraid of a possible public health crisis. But we can protect my constituents and all New Yorkers without doing it this way, without holding the funding hostage to consolidate power. We could decouple the bill and take the time to make sure that it is thoughtful. This bill broadens the circumstances in which our governor can suspend laws. This bill broadens our governor's abilities to suspend laws. And this bill will also broaden the range of circumstances in which our governor can direct his executive order. Yes, we put into the language a sunset. And yes, the legislature may terminate by concurrent resolution any executive orders issued in these particular circumstances. But as Dick Gottfried, our healthcare, has said, sometimes things don't sunset, and sometimes things aren't terminated. It is easy to give up power during times of fear, but history tells us it is rarely easy to take it back. we as the legislature are supposed to be the check on this. And here we are ready to hand all of the power to the governor in a day.
We're in the month of March. It's March 2nd,
We're in
2020.
the middle of our budget. That's the budget month.
That's right.
March is always budget month in the New York State Legislature, just
That's right.
FYI.
It's about 1:30 in the morning. Actually, so now it's March 3rd. Yikes. And it's 1:30 in the morning, and we've just come off of a very unfortunate day, I would say.
It's a hard day.
We are also experiencing a pandemic across the world with the coronavirus. And even though we've had our
COVID-19.
and even though New York has not had any deaths yet, I think probably a majority of people believe that we should have a plan. However, not the kind of plan that's been proposed today. The kind of plan that was proposed today was a Cuomo special.
One would call it that when it's a win-win situation for him and a lose-lose situation for everybody else.
And it's one that really is just very unique in that I've never really seen anything like it. Taking
Really?
advantage of a moment where people are dying for political advantage is probably the lowest low I've seen in my entire life.
Making a power grab during the time when people are literally talking about weaponization of fear and criticizing it on the federal level, and then doing it ourselves is pretty low, isn't it?
That's right. It's the lowest you could possibly go. So
When they first presented to you the idea, did they say it was 2 bills or 1?
they said it was one bill.
To us, they said it was 2.
That's so interesting. So what we're talking about here is basically this piece of paper. A piece of paper that represents a vote that we took tonight when we gavelled back in for the second time yesterday and now. A piece of paper that was negotiated without any of the members of the legislature having knowledge that it was even happening.
Well, we haven't even seen it. Like, literally, we didn't even know this existed yet.
That's right.
As in, when we were conferencing the idea of this bill, we hadn't even read it yet.
That's right.
They didn't even give us language yet.
That's right. So we were basically surprised, not shocked, but surprised that there was a bill. In fact, I actually naively thought, wow, what a positive thing. We're taking initiative to be leaders on something that
It's so important that everybody is actually talking about right now.
That's right. The whole world is talking about this. And I thought, wow, I'm proud that New York is finally taking a step forward. However,
No.
when you read the bill, it really doesn't do anything, I think, that anyone really wants it to do. It's an amendment, essentially, to the executive law. The executive law is the law that governs the governor in the state of New York. And what it really does is it expands the powers of our executive to enable whoever the executive is to make directives basically for any reason at all. But do you want to tell them why it was so tricky? What was it tied to?
What do you mean, what was it tied to?
The money.
Oh. You're talking about, so this is why we thought it was 2 bills. The 2 ideas that were presented to us. One was an expansion of his powers, which we were like, bleh. And then, of course, the other one was for $40 million to make sure that we could help to prevent a pandemic.
Right. Because that would have been actually responsible.
That would have been good. That would have been governing.
That would have been like a real government functioning for, all of you, which would have been amazing. However, that's not what happened here. So what happened here was actually the $40 million request from the executive tied to basically an unlimited power for the executive to have in moments of disaster and emergency.
By the way, the part about this is that in imminent times of disaster, the governor already had the majority of the things that are written here. The governor already had the ability to do the things that we need him to do when it comes to an emergency, which is like to make sure that there's funding, make sure that people are taken care of, and temporarily be able to suspend certain laws, etc. But with the language that was added, there were particularly difficult things to swallow.
The problem here is that this is about politics. It's actually not about helping New Yorkers. That's what this bill is about that. Even though the bill enables us to permit the governor to use $40 million, we could have done that without this piece of legislation. We could have done that through a message of necessity, through a resolution on the floor. Those are the technical terms of how we could have done it.
To the budget.
Right. However, we did it through this piece of legislation. Why? Because the governor has used this opportunity of imminent crisis to take advantage of the legislature and of our vote and tied the expansion of his power to the release of resources for coronavirus. So now here we are.
Here we are.
And
at 2 a.m.
we're going to have to try to figure out what to do.
Thinking about our constituents and thinking about how
you're feeling badly because of the perception of voting no. I'm feeling badly because the right vote was not yes, even though, of course, we want to do something about coronavirus. As Yuh-Line said, this is not the way to do it. This is disgusting. This is not what a New York State legislator, the caliber of a New York State legislator, should be doing.
I'm not upset by the perception of voting no. I am upset because I feel like we are in a puppet show.
We are.
And I think that it's really, really upsetting to me that it doesn't matter that I voted no. It doesn't matter that you voted yes. It doesn't matter that either of us even took a vote today.
Nope.
The decision was made for us before we got into the room.
Mm-hmm.
So the governor issued, with his expanded emergency powers, hundreds of executive orders in the last year. I mean, hundreds, okay? Like this is, actually, we printed them out, and there are hundreds of executive orders that the governor actually had made during this time. So I'm just gonna leave this here since it's very large. I don't wanna hold it in my lap.
In terms of the emergency powers and the executive orders, I'm excited that we get to talk to our Senate Health Chair, Senator Gustavo Rivera. So we're going to bring him up now and ask him a few questions. Senator Rivera has been a champion of so many things, including the New York Health Act, Safe Staffing Act, but has been an especially important voice during the COVID-19 pandemic, and has been very much a seeker of truth.
And also to note, he didn't vote for these emergency powers.
That's right, he did not. So we're so excited and honored to be joined by the Senate Health Chair, Gustavo Rivera, Senator Gustavo Rivera, who is also a fellow Bronxite. Senator Rivera, we're so happy to see you.
It is a pleasure to see you, and you have a fancy set. You told me I'm going to do a thing, like a show, and I was like, a podcast or something. It's like, no, I actually have to get dressed up for it. Like, y'all's a professional. I'm very happy to be here, but damn.
Only the best for you.
Yes.
And I appreciate it.
So we have a couple of questions that we just really, really would love to be able to ask you about because, obviously you're the healthcare chair in the Senate and the expert on so many things, but also because you and I actually talked about this at length. So the emergency powers, the powers to be able to make a directive, that bill, and then also the extra emergency powers that we gave to the governor, the extending of his emergency powers in the budget. Both of us, you and I, actually voted against the emergency powers.
Yes, which is why I would have to correct you because we did not give it to him. They gave it to him. Our colleagues, unfortunately, many of them were convinced that these things were necessary. And for your viewers. Now the governor has a lot of executive authority that's already baked into the New York State Constitution to handle emergencies. It happens all the time. If there's natural disasters, floods, any type of snow emergency, et cetera. The governor already has authority to deal with emergencies, but he felt it necessary to come and ask us last year to give him a lot more authority. And so it was baked into the budget, and I'm sure that you'll have a long conversations about how messed up the budget process is. But the thing is that what the point is that these emergency powers gave him the ability to set directives without any oversight or involvement from the legislature, basically doing things at this point, hundreds of things, so even dozens on a particular day, without the involvement or the oversight of the legislature. And by doing that, he was able to just not include any of us in the conversations, which made for bad policy. Many of us have been pointing it out since the beginning, and many folks are starting to notice it now.
So just to kind of, I guess, remind folks about that little bill, I guess.
That little bill.
That little bill.
Tiny, little, infinitesimal bill, yes.
Yes. At what point, when in our passage of it, did it come into the light, I guess? Because, I mean, I remember it was dark, actually, and not light, and it was in the middle of the night. So how long did we have to deliberate the bill before it came to us as a body, both sides of our houses? And then on top of that, when did we actually get the written language of what the wording was going to be?
Yeah, Yuh-Line, when you said it was dark, you mean both literally and figuratively. Because not only did it happen in the dead of night, but it happened without, again, the involvement of most of the legislature. We were given this, I don't recall the exact timing, but I do know that I was sitting in my office in the middle of the night talking to my staffers and going like, I'm looking at these powers. This is way too much to give this guy. Why are we even having this conversation? I'm being asked to take a vote to extend all these extra powers. He doesn't need any of these. Like, I remember having this conversation in the middle of the night. So it was not something that was inclusive. Look, what the governor did is what the governor usually does. He never, what it is said that you should never waste a crisis. Well, he didn't waste this one. And in this case, somebody who already has all sorts of tendencies to be an authoritarian saw an opportunity to take even more power and involve himself more in the policymaking and involve us as a legislature less. I mean, I've been in the legislature for 11 years, for as long as the governor has been in the governor's mansion. And in that time, every single budget, going back to my first one in 2011, I can remember having constant conversations about how the governor would include things in the budget to extend executive authority. On all sorts of ways, small and big and small. Sometimes it would catch it, sometimes we wouldn't. Sometimes we would point it out and it would be excised. Sometimes it would be left in. Bottom line is that this is a guy who's always wanted to be by himself in that house, in the Capitol. And we as legislators, we're just a pesky inconvenience. And so he took the opportunity in the middle of the crisis to say, we obviously, this is a time for executives. This is a time for leadership. It is not a time for pesky legislature. So give me these powers and allow me to take care of New Yorkers as only I can do. And many of us saw through it, and it's taken many, many months. But I'm happy that finally our colleagues are joining in.
And the Senate got the language for that before the House, obviously, the Assembly. And I remember
didn't you not even get the language?
I didn't even get the language. I got it from you.
That's right.
And actually, you guys got the language hours before we did, but I remember only getting it literally 2.5 hours before we voted.
That's right.
That sounds like, well, again, good old Albany for you. We have changed much about it. The fact that both of you powerful sisters are part of the legislature is a sign of things that have changed, but obviously some things have not. And this is a perfect example of that, how things happen in the middle of the night. And with this governor in particular, he loves to do things in the middle of the night without telling the rest of us. Again, pesky legislatures.
So on March 25th of 2020, March 25th, 2020, last year, before the budget was passed, the State Department of Health issued a directive to instruct nursing homes to accept COVID-positive residents returning from hospitals if they are medically stable. At the time, many hospitals, particularly in the city, were overwhelmed with patients. We knew that, and were looking for ways to free up beds. The directive stated that no resident shall be denied readmission or admission to the nursing home solely based on a confirmed or suspected diagnosis of COVID-19. So that means that if a resident was to have a diagnosis of COVID-19, being positive or if it was suspected, because there was so little testing then, if it was suspected that they had interaction with other COVID patients, that they should not be denied readmission to those nursing homes.
So then following the March 25th directive, right, we have March 30th of 2020, and this is when the 1,000-bed USNS Comfort, that Navy hospital that pulled into New York Harbor, arrived and docked in Manhattan. Only a few days later, right, April 2nd, throughout that entire week, only 20 patients actually were transferred to that ship. And there was a really stunning quote from a very prominent medical professional in New York, Michael Dowling, who is the head of Northwell Health, which is New York's largest hospital system, who of course would know that the beds in their hospital system were packed, that there was a shortage of hospital beds.
They're literally the ones doing the vaccines right now.
That's right. They are the ones
pop-up
rolling out the
sites.
vaccine. That's exactly right. That's right. And so in the New York Times, he was quoted saying, "If I'm being blunt, it's a joke." And this was in response to the USNS coming to New York and not being filled or not being used.
Wow. And this is particularly stunning because on April 9th of 2020, the operator of a nursing home in Brooklyn asked the administration if it could transfer residents with confirmed or suspected COVID-19 cases to the Javits Center, which had been set up as a federally run COVID field hospital as well.
Which is a reasonable request to make.
Reasonable request.
Yes.
Or the USS Comfort, right?
Yep.
Which had, of course, docked in Manhattan for the same reason, as you just said, both which were actually mostly empty, as you said, and the state denied the request.
Which is really interesting, right? Because only just recently, right, on February 15th of this year, 2021, the governor actually used as an excuse in his press conference, he basically said, we didn't have enough hospital beds. And he said that because he was implying that there was just nowhere else for COVID positive nursing home patients to go, which we know is false.
There were 2 places.
That's right, at least.
At least. I still remember there were places like set up in Central Park.
That's right, Van Cortlandt Park in the Bronx.
Yeah, Van Cortlandt Park. Jumping back to April 20th of 2020, just 11 days from the 9th, which we were talking about earlier when the Brooklyn operator was denied the request, Cuomo indicates that he is actually not aware of his own health department's directive.
From March 25th.
Yeah, about admitting residents who tested positive for COVID. And Health Commissioner Dr. Howard Zucker reiterated that nursing homes should accept those residents and that the necessary precautions were taken. Like literally that just happened like days.
And like, why is this so crazy? Because the governor is someone in the state of New York who controls the entire government, right? So what that means is that nothing happens in the state without his knowledge. So him saying that he didn't know about the directive is questionable. Only 3 days later, after April 20th of 2020, Governor Cuomo says that nursing homes, quote, don't have the right to object to the state directive, adding that if they can't properly isolate COVID-19 positive residents, they must transfer those residents to another facility or ask the State Department of Health for assistance. So this directive does not reference a nursing home's ability to contact the state or transfer residents to another facility if they cannot isolate. So basically, he is saying, he's doubling down on this directive and saying, you must do this. You must take these COVID positive patients into nursing homes.
And even more stunning is right after that, Zucker actually said that he is not aware of the state having received any such request, when obviously we know of at least one.
That's right, the Brooklyn operators, at least one. We know that there must be more.
So two more big moments happened this last year. On May 10th, that was when, after intense pressure by the public, by the families who lost loved ones,
that's right.
By our own Assembly member Ron Kim, my friend, Cuomo rescinds the nursing home directive
From March 25th.
Yeah, with an executive order.
Yep.
And replaces it. Replaces it with a policy that states that nursing homes cannot accept residents without a negative COVID test. Right. Then on May 20th, 10 days later.
My birthday, but yes.
Oh, happy birthday.
Thank you.
Cuomo says that the state was actually trying to follow the federal CDC guidelines all along, when it issued the March 25th directive. It's a claim that actually Cuomo and his surrogates will repeat many, many, many times, including that time when you were referencing on February 15th of 2021.
Just recently.
Just a couple of days ago. This is a statement that has already been obviously deemed by fact checkers as
mostly false.
So here are the CDC guidelines. And on or before May 20th, the state removed the March 25th directive from the health department website.
That's how bad it was. They had to take down the evidence of the directive on the website.
So here's the CDC guidelines. Take a look. These are the comparisons side by side.
Yes. Crazy. So as you can tell, the guidance and the contradictions started to be incredibly confusing for not only nursing homes and hospitals, but also for their workers, and frankly for the public, and if I'm being honest, for legislators who were trying to also guide and direct the public. It was confusing also for us. So there's a lot more to talk about. Thank you so much for joining us, and we'll be talking about the immunity scandal on the next episode, so stay tuned.